1, 2, 3.
Officially opening the Gold Coast's newest primary school. The Premier went back into the classroom, but she's facing a test of a different kind that's causing another playground fight with the Federal Health Minister.
I'll let Greg Hunt look after his job and I'll do my job. And, now's not the time to fight.
Mr Hunt has singled out Queensland, criticising the government for making PCR testing mandatory for interstate hotspot travellers once the state hits the 80% vaccination target. The tests cost up to $145 at private pathology clinics.
Greg Hunt can quite easily make it a Medicare rebate. He can do that with the stroke of a pen.
In a letter sent last night, Mr Hunt asked the government to drop the more stringent PCR tests and use the cheaper rapid antigen testing instead. But Queensland claims it's being unfairly targeted. It's not the only state or territory where the tests are compulsory for hotspot travellers. They're also mandatory before arriving in Western Australia, Northern Territory, South Australia and Tasmania. The Premier says the Commonwealth is playing politics by picking on Queensland. She insists the PCR tests are more effective and are only temporary until 90% of eligible Queenslanders are double dosed. That's likely to be in early January.
I don't want to see the people of Queensland get COVID for Christmas.
The requirement will also affect Queenslanders wanting to visit hotspots in New South Wales or Victoria.
At the moment, going to Sydney for a day or two would be out of the question until we get to that 90% double dose.
But late this afternoon, a breakthrough. The Federal Health Minister issuing a statement that the Commonwealth and state jointly fund tests for people who require it for a public health order, so long as the result can be conveyed by text and not a certificate. That means the tests can be done at public health clinics for free. Queensland has welcomed the clarification, saying there's been a great deal of confusion around the issue. Rachel Rieger, ABC News, Brisbane.